Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill, and I am thrilled to have Tria Health as our guest today. They are a chronic condition management company that personalizes care for members and simplifies benefits for members and employers struggling with the rising cost of chronic conditions. And we are here to talk about their Choose to Lose program, a weight loss and obesity management program. Jessica, can you tell us more about Tria Health and the team that you have here to discuss it?
Yes, thanks, Lee. We're so excited to be here today to talk a little bit about a program we call Choose to Lose. Choose to Lose has been a part of Tria Health for over 5 years. But as a company, Tria Health focuses on ensuring that individuals who have chronic conditions have the opportunity to have a pharmacist work with them to ensure they have the best outcomes. In that same light, when we think about how chronic conditions tie into another chronic condition we talk about with obesity, Choose to Lose is really about ensuring that we provide pharmacist led interventions alongside health coaching regarding nutrition and exercise. So, we're excited today to have Austin Morgan, one of our pharmacists at Tria Health, and then Jenny Edwards, who leads our health and wellness division, to talk a little bit about our approach to Choose to Lose.
Great. So GLP-1s is a hot topic that we've all been discussing recently. And I know your program has been around a lot longer than, GLP-1s has been in the headlines. Can you tell us a little bit more about these medications and what are some of the common misconceptions that you've encountered?
Yeah, that's a great question, Lee. So, the medication class overall has been around for a really long time. They were originally developed to treat diabetes, and then, as a fortunate happenstance, also seemed to cause weight loss for a lot of people who use them for diabetes. That ended up leading to a number of them being approved for weight management and overweight and obesity. And the medication class actually mimics a hormone that our body makes naturally, and you could basically say that they're just stronger versions of that hormone. They help slow down our gut so we feel full more quickly and stay full longer when you take this medication. And then they also work in the brain to help regulate the appetite center in the brain. So a lot of people who use these medications will report that they just have a suppressed appetite, that this food noise, feeling like they just don't have thoughts about eating as often, goes away with the medications. So those are the two main mechanisms on how the GLP-1 class seems to help with overweight and obesity and weight loss. And then some common misconceptions that I see in practice are that one, the medication class will work for everyone. There are some people with overweight and obesity who don't respond to these medications, and that showed up in the clinical trials as well. And then the flip side to that is that for some people who use the medications, that if they have side effects, which all medications do, and this class is no exception, that you simply cannot use them. And that's not entirely true. There are strategies to help manage side effects, decrease the severity of them, and help people work through them to get the best results if the medication is appropriate. And then the third misconception I'd say that we run into in regular practice is that the drugs themselves are a magic bullet, if you will, that just taking the medication by itself will cause you to lose significant weight, can help you keep that weight off long term without doing anything different when it comes to lifestyle modifications. And I would say that for some people, they will see benefits without making those lifestyle changes. But in all of the clinical trials that led to these drugs being approved, they were on top of the backbone of lifestyle modifications with diet and exercise changes. So that's a big part of what we talk to patients about in practice is making sure that not only do you use the medication safely and effectively, but how can we help ensure that those key lifestyle components are part of that treatment process?
So, Tria Health has built a great program to help with the lifestyle modifications to go with the drug changes. You have brought in a health coach to your team that really helps these members get on the right track. Can you help, Jenny, explain to us some of the lifestyle modifications and health coaching you're using for some of the members?
Absolutely. Thanks, Lee. We really start here at Tria Health by looking to build a strong foundation of rapport and being able to understand each patient's unique needs. We have to know their preferences and their specific challenges so that we can build a program that meets them where they are. We utilize motivational interviewing and help them set goals. We build nutrition plans that are specific to the patient and their needs, along with just developing and help them implement lifestyle modifications so that they can have overall healthier lives. Of course, we do, for patients who are interested, we try to loop back in and let them have the support of our pharmacist team as well. So we can always implement the lifestyle and behavior changes through the coaching process and also have them get support through our pharmacists.
So it sounds so easy. Talk to a health coach, take the medications as they're prescribed, but there has to be behavioral modifications that come with this too. Can you provide some insights into the behavioral modifications that support long-term weight loss success?
We really focus on nutrition. So personalized nutrition plans, as I mentioned, we're working with that patient to help them create balanced and nutritious meal plans tailored to their lifestyle and their preferences as well. So we are working with them, developing food logs. We do have our patients log their food, and we look at the macronutrient components of that food that they're eating so that we can help them better understand that the quality of the food they're eating is more important than quantities and just calories in versus calories out, making sure that while we're tracking calories, we're really looking at the quality of the food that they're eating to get those calories. We also look at physical activity, helping patients develop realistic physical activity components so that they can move their bodies in a healthy way, helping them burn more calories as well. So all of those are components, and really the goal setting, the communication with the health coach on a regular basis helps really cement that in and help them sustain those goals over the long term.
Let's talk about long-term management and follow-up. What are some of the key considerations for long-term management for the patients on GLP-1 therapy?
Yeah, I think that's another really important question to talk about, Lee, because in the trials, people use these medications for a long time to help ensure ongoing effectiveness and weight loss. So, some of the things that we're talking to patients about from a pharmacist perspective when it comes to the medications is making sure that they're continuing to be safe and effective. So, are these medications tolerated well? I mentioned earlier that some people will have side effects with them. And there are some key strategies when it comes to the types of foods that you eat, the quantity of foods that you eat to help minimize the side effect profile and make it tolerable. The other side is making sure that people are seeing results with the medications. I also mentioned that not everyone responds. So, a key benchmark parameter when it comes to weight loss, particularly with medications and keeping the long term health benefits in mind, is hitting at least a 5% weight loss at about a 3 to 6 month mark with these medications. And so the GLP 1s in particular do take time to move the dose up to the target dose. It can take 3 to 6 months to even get to an effective dose for some people. So we want to make sure that they're tolerating the medications over time, that they're seeing weight loss as expected over time, because the medications are expensive and they can carry some risks. So if people are not responding to them, we want to make sure that we help them find an alternative that might be more effective if this isn't the right fit for them.
So you mentioned cost and how these can be expensive, and there's no use paying for something that's not providing the results that you're expecting. Jessica, can you tell us about some of the challenges patients may face in accessing GLP-1 medications, particularly in terms of cost or insurance coverage?
Yeah, I think a couple of things have really began to be conversations in the benefits arena. And I think for employers, many of them didn't provide coverage for obesity up until this point, and many don't still. I think we're about at a 50% coverage rate right now for employers. And what we expect to see is that over the next several months, within the year or so, I think that's going to change. And I think a couple things have happened. One, we are now seeing these drugs getting approved for the prevention of cardiovascular disease. So not only are they helping people lose weight, but they're also allowing us to prevent further disease or other chronic conditions. For employers who have historically had the approach of, we're not going to cover obesity treatment, a lot of times that had to do with the types of medications that were available. They weren't as effective, or they had a lot of side effects. And also, frankly, too, just reclassifying obesity as a chronic disease has really put employers in the place of needing to make decisions on whether they want to cover these. So, for an individual user who may be ready for that journey and be ready for the coverage, they may find that their employers don't cover it yet. But we know employees want this. And I think what's going to happen is that employers are going to begin to make decisions, but they have to do that in the context of their budgets. And as we know, self insured employers are trying to manage all of the expensive costs related to health insurance premium increases and medication increases. So they have to take that in the context of the bottom line. And I think for some, that is not going to be an opportunity. And so employees may not be able to actually cover these medications. And if they can't cover these medications, then the individuals or the employees are at that place where they have to decide whether they can utilize coupon programs that are available. And that's some of what our pharmacists can really do, is help individuals make decisions regarding the cost of these medications and whether that's something that they can invest in. Unfortunately, what's happening too is that a lot of people are choosing to use sort of off-label compounded medications that we're seeing in the marketplace. So for employers, they really need to really dig into their employer strategy and how they want to approach coverage of medications as it comes to the obesity category of medications, and then also long term, how they want to really approach this conversation about, if we can get people to maybe lose a little bit of weight, maybe we also improve some of their cardiovascular benefits. We also may improve some blood sugar. We may also have the ability to reduce some other medications, which is kind of a brain philosophy that's not always been sort of immediate for many of us.
And it'd be amazing to see, what does it look like not having these drugs, where their health journey goes. Is it going to be more expensive down the road?
Exactly. And I think that's the challenge, is that sometimes we think about medications purely for their cost, or for lack of a better term, their AWP, or whatever I'm going to pay as an employer. But the reality is that for these individuals who have multiple chronic conditions, and I know Austin and Jenny can attest to this, these individuals are on 7, 8, 9, 10 medications, seeing the doctor, having hospitalizations. And maybe if we looked at it at a different approach of, how do we get the right person on their health journey, and it may be medication related and it may not be. Maybe we need medications for treatment of obesity, but maybe we just need to get them on the journey of how to begin to help themselves in choosing the right nutritious foods and moving more, to ensure that we're also helping the medical costs as well, which is really where we start to see long term cost related.
And I love what y'all are doing. If the drug's not working, let's find another solution. So, Jessica, we talked about long term costs. What does the crystal ball look like? What are some of the future developments in this field that are exciting or promising?
Austin and I can attest to the fact that there's hundreds and hundreds of drugs in the pipeline for the obesity treatment. And there's a lot of exciting things coming down the pipeline that are going to be even better than what we're seeing. I think that we were all wanting something that was going to help people lose weight. And while we would all love the magic pill, there's no magic pill. But what I think we're seeing coming down the pipeline from a clinician's perspective is some drugs that may be incredibly beneficial to many people, because it will help them to lose weight but preserve muscle, which we didn't even get into really here. But the fact that some of these medications actually cause weight loss, and your body doesn't choose whether you lose fat or muscle, you lose weight sort of indeterminately. But there are going to be some medications in the pipeline that may actually focus on preserving muscle tone and helping to reduce fat loss. But all of these medications coming down the pipeline are not going to be cheap. So from an employer perspective, when you think about paying the bills and being able to sustain a employee benefit program, I think what employers need to do is to understand that these aren't going away. And so they have to create a strategy for employee benefits that includes something related to ensuring that we're giving the employees the resources and tools they need to begin to choose healthier lifestyles. And I think that's sometimes going to be, if they can afford it, a strategy around accessing coverage of these medications if individuals are actively involved in a lifestyle management program, which is what we obviously endorse at TRIA, which is why we feel strongly that it's really important to not only have a health coach cheering them along the way, giving them the resources and the tools they need to be successful, but also the pharmacist who can also cheer them along the way with the resources and information they need to understand how to access the medications if it's right for them and give them the best recipe for success for long term health for these individuals, which hopefully results in reduced cost for the employer.
That's right. So, if anybody wants to find out more or to be involved in your Choose to Lose program, where do they need to go to inquire?
TriaHealth.com is probably the best place. So TRIA health.com. We have resources there that obviously show and illustrate our many programs, including our Choose to Lose program. And we'd be happy to get back with anybody who had any questions or concerns about that.
Great. Well, thank you, Tria Health and Jessica, Austin, Jenny, for joining us on another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.